Great. So thanks everyone for joining us. This is a project that was kind of a long time in the making. And we'll tell you a lot more details as we kind of go along here. But this is like our official launch event for the Voices of US Healthcare project, which is short version. It's designed to identify and surface folks with powerful stories about the healthcare system, and to share them in kind of an organized public way that integrates with our organizing work and our lobbying work across the country. And if you've followed casually any history of any social movement, you kind of know the importance of powerful impact stories in creating change. And we're no different here in the healthcare system. And I think we're actually we're in the terrible/great position that almost everyone has a healthcare story to tell. Unfortunately, almost everyone has been directly impacted, or someone in their lives has been impacted by the healthcare system if they've lived in it long enough. So the idea is to not just to do story banking, but also to help people who have stories move into leadership roles and take on important roles changing the movement. I'm going to start off by just talking a little bit about why storytelling is so important for social movement work and for organizing work in general. And if you've taken our Telling Your Story, Your Healthcare Story training, then this slide might be familiar to you. The slide that
I am going back.
We'll have to go back to. I like to call this one a research data-driven explanation of why you should not use research and data. So, so this was a study, and this was just one of actually many studies with the same exact findings. This was a study where a team of researchers were looking to explore how people are impacted and motivated to take action by hearing stories versus hearing sort of statistical presentations of a problem. And so what they did was they gave a survey to people. I think this was they gave a survey, and I don't even remember what the survey was about, because the survey was actually kind of a fake thing, and all they really wanted to know is what people did after they finished the survey. So after they finished the survey, everyone who finished it was given $5. And then they were then given the opportunity, if they wanted to donate a portion of their $5 to a charity, whether that's all of it or part of it. So what they did was they divided people into three different groups. So some folks, they were told the story of an individual child who was suffering from hunger. I think this was Save the Children was the recipient organization who would get the donation. And then some people were told, given statistics about how many children suffer from hunger globally and how their donation can make an impact. And then the third group was given both. They were given the story of one identifiable child who was dealing with hunger and had a name. And then they were, after that, given statistical data about the prevalence of hunger among children globally. And what they found was pretty shocking. And again, this has now been replicated many, many times by lots of different social psychology research, that when folks were given just the one story of the individual, they were far more likely to give, and they were far more likely to give more money to the charity. So Identifiable Life had they call it Identifiable Life. It just means an individual story, a one person story, generated the most action, the most sort of empathy and compassion. Statistics and data had far less of an impact on people. But the thing that might surprise you, and that surprised me at first, is that when they told the story of the child and then they added data on the end, that also did worse. It did almost as bad as just giving a data presentation. And what researchers have found is that essentially, once you start talking about statistics and data, even if it's about something extremely important like the prevalence of hunger, or how many people are uninsured in the United States, or how many people go through medical bankruptcy, all that really important data that a lot of us like to sort of memorize and talk about. It puts people in sort of an analytical mindset, and they stop thinking with their emotions and with a moral and ethical framework. And researchers have also, outside of this study, discovered that as soon as you start adding more than one person to a story, people have a harder and harder time empathizing with it and have less of an emotional reaction and are less likely to take action themselves. So once you start telling a story of a group of people, like 3 or 4 people, like a family, people have a harder time empathizing, less likely to take action. If you talk about a group of 10 people or a school, as soon as the higher up you go, the less people are to have an emotional reaction, the less they are to actually decide to do something about it. So this is why stories are so incredibly important. Stories about one individual person and what they have gone through, or a couple or a very small family unit.
So we know why storytelling works at the human level, right? But we want to make it clear that this isn't just about feeling good about ourselves or feeling sad about the state of our healthcare system. This is actually about moving people to action, right? And historically speaking, storytelling has been the heart of moving people to action in this country and globally. So I just want to give a couple of examples that I'm sure you'll be familiar with, right? The first one is Rosa Parks. How many people here have heard of Rosa Parks? Yeah. Okay. If you're not raising your hand, you're probably not from here, right? Because in elementary school, we all learn about Rosa Parks. Her story demonstrates like the power of a single story to captivate a nation and really define the narrative for an entire movement. So Rosa Parks, for those of you who don't know about her, her actual past, right? She was a trained, super sharp activist and organizer. She had attended workshops at the Highlander Center. She was a leader in her local NAACP chapter. But the story that she presented to the public, right, to the media and to politicians, wasn't actually about systemic change and resistance. It was about an ordinary woman who was tired of sitting at the back of the bus, right? And that story captured public attention. It's come to represent the historical legacy of the civil rights movement. Now, do more people need to know about the awesome history of how Rosa Parks prepared herself for that action that she took? Absolutely. But it's worth mentioning, right, that she knew that that emotional story was what was going to hook people in. When I think about story sharing, one of the things that I think about a lot are the consciousness raising circles of the feminist movement of the 1960s and 70s. Does anyone remember any of these? No? So consciousness raising circles were basically a kind of tactic of feminist organizing. Women gathered together to tell their personal stories, and what they found was that their stories weren't all that different. Right? They had all experienced some of the same problems in their relationships with men and male institutions. So all of a sudden, for these women, as they told their stories, right, it became clear that their problems weren't just personal, right? They were systemic and pervasive. So, just as Rosa Parks' story shows us, right, that folks, need to get up and get involved no matter how tired they are, right? Really, what the consciousness raising circles of the 1960s and 70s, they taught women that they weren't alone. And that's critical in organizing our movement. So another example that I wanted to bring up from our movement is the Sicko movie. How many people remember the Sicko movie? Wave your hands if you do. I know I remember the Sicko movie really, really well. And Sicko movie is a really good illustration of how stories expose injustice. Basically, the Sicko documentary featured patients who were struggling with American healthcare system, and the kind of dissection of what the problems were with that system. But what people remember most is the actual folks who were dealing with illness, dealing with healthcare in this country, who were featured in the film. Now, that movie inspired thousands of people, including myself, to take to the streets in the fight for the Affordable Care Act. Do we love the Affordable Care Act? No. Um, I'm not going to argue for that. But I will say that that fight definitely represented what we really need to see, which is a popular movement for healthcare justice. Um, so at this point, with that in mind, I'd love to introduce one of the storytellers who is included in the Voices of U.S. Healthcare database. She's our Healthcare Now Board of Directors member and one of the stars of Sicko, is the brilliant, beautiful, and talented Donna Smith.
Wow, I never got introduced as the beautiful and talented Donna Smith before. I'll tell you that. Thank you all, and I'm so glad so many people joined to talk about the importance of patient stories. Before my husband Larry and I appeared in Sicko, we felt pretty damn alone. I will be honest about that, even though we were aware that the healthcare system had problems all its own. We felt like the fact that we couldn't figure it out and the fact that we couldn't pay the bills from it were our fault. That was our failing somehow, that we couldn't make that happen. We were living in South Dakota at the time. I was a small town newspaper editor. Larry my hubby, had just been scheduled for his third open heart surgery. I had just recovered from cancer. And a friend of mine called and she said, Michael Moore's working on this new movie about healthcare. And I said, oh, yeah, okay, really? I said, Michael Moore's working on a movie about health. What good will that do us? We have insurance. They're going to want to talk to everybody who doesn't have insurance. And I let it go. A couple of weeks later, same friend called back and said, I really wish you'd send something in. So I said, just to shut you up, I am going to send in a note to Michael Moore's folks about what's going on with us. But I did so kind of quietly because my husband, one of the things that was going on for us is we got so many collection calls every day from medical collectors and from everybody who wanted money from us, that I would turn the ringer off on the phone every day until 8 o'clock at night, when collection calls have to stop by law. And I would listen to all those messages. And then the next day I would call them back so my husband didn't have to worry about it with his heart. And I remember thinking, something's really wrong with this, that I have to hide what's going on with this from my own husband, because I don't want his heart to hurt from all that's going on with our finances. So in any case, about 6 weeks later, after I sent the email to Michael Moore's folks, I got an email back from a producer who said, we're doing a film about insured Americans, how many insured people are going bankrupt because of their healthcare expenses. And that's exactly where we were. And it was horrifying to me. We had a home, we had worked all our lives. We'd always had insurance. I felt ashamed, but didn't know why I should feel ashamed. It was just a terrible situation. So I wasn't quite sure about telling our story. I knew I was giving up a role as a newspaper editor. I would never again be seen as an independent newspaper editor. So I just thought, okay, this is a chance to perhaps make a difference in a way that other people might not understand, and a lot didn't. Our family wondered why we wanted to get hung up with somebody like Michael Moore, all of those different things. And so I decided that, yeah, we got to do this. We have to do it. So they came and filmed us actually moving into our daughter's storage room. We moved away from South Dakota and moved back to Colorado. Broke my heart. I always wanted to be a newspaper editor. It's the only time I was lucky enough to be one. I sobbed when I went across the state line because I figured I would never again be able to do that, even if it was a small town. But as a result of having been in Sicko, I know that it has been shown all over the world in the last 15 years. I did testify to Congress about medical debt and bankruptcy in insured Americans. And I think I am still the only American who's ever testified to Congress who had insurance, who went bankrupt. And yet it made such a difference. I think it made a huge difference in the course of what happened. The Affordable Care Act, I agree with Jillian, it's not what we all want at all. But guess what? It saved my life. Because after I was no longer a newspaper editor and I had to get different jobs and I had to have insurance, I'll tell you what, no one was going to want to insure this family. Somebody with 3 open heart surgeries and cancer, they didn't want any pre-existing conditions in this bunch. So anyway, the importance of storytelling, I think, couldn't be overstated. I think the slide that Ben showed and that Jillian showed about how important those personal stories are is hard to understand, because people are always throwing at me, how much is it going to cost? What's the cost of all this? What are the taxes going to be if we go to Medicare for all? What's going to happen? And they seem to be crying for the statistics, and yet that's not what moves people. What moves people when they see people like themselves, hear people like themselves who are going through the same thing through no fault of their own, but because the system is just flat broken and it needs to be fixed. So, and anyway, that's probably more than you ever wanted to hear, Jillian and Ben, but that's my pitch for and then I did say one other thing. I did go to work for the California Nurses and National Nurses United afterwards. And my first job for them was to actually take in all the patient stories that came in and to write one story a day using one of those patients every day. And I still remember those stories. I don't remember a lot about those first few months, but I do remember those stories. I remember the stories of children and cancer patients and heart attack victims and people all over the country whose lives were broken by this system. That's what people remember. So anyway, thank you. Back to you, Ben and Jillian.
Thank you so much, Donna. Really, really appreciate that. And, really appreciate you kind of setting the example by coming forward. I know a lot of us probably on this call have told our healthcare story at some point. And I think a lot of us have faced the same resistance from friends and family, same with those same senses, that same feeling of shame, right? But once we get to the other side, right, things do get better.
You find a new family. You find a new family sometimes in people who understand and who care enough to fight with you. I really believe that. And not that your biological family becomes less important, but you find out there are kindred spirits who love one another and want to fight together for this.
And I am happy to have you as my single payer sister. Thank you so much. So Donna's story is amazing and is very, very powerful. But the fact is that everyone actually has a story like this, right? The number of people who are benefiting from the healthcare system is very, very small. The number of people who are being impacted in a negative way is huge, right? So everyone has one of these stories to tell, right? What we need for our Medicare for All movement is a way to collect them and share them, and that is where Voices of U.S. Healthcare comes in. Ben, you want to take it away?
Yeah, so this project we've just launched, the biggest part of it is just a big public-facing database on the Healthcare Now website of personal stories from patients and providers and actually anyone else who's been impacted by the healthcare system, whether that's healthcare insiders who want to tell a whistleblowing story, or business people, or union members who have to negotiate their contracts, give away wages every contract. And to make this an easily navigatable and sortable database of stories. The reason we decided to organize it like this, and I can't believe it's actually taken us this long, there was a hearing in one of the big, I can't remember, there was one of the big committee hearings in the House that we won 2 years ago, and all the members of the squad were on this committee. So AOC, Ayanna Pressley, Rashida Tlaib, and they wanted to identify a patient with a powerful story in each of their districts to testify at the hearing. And none of them knew anyone, which was a little surprising on its own, but they all came to us, and we scrambled really quickly to find folks in their districts who had stories to tell. So we were thinking of people we knew. We talked to our local groups in those areas to identify folks real quick. And we did find people, but we started thinking, like, why are we scrambling every time there's a request to have a powerful patient testimony? Not just for big congressional hearings, but every time we visit a legislator to ask them to support Medicare for All, there should be at least one or two people telling their patient stories at every single one of those delegation meetings. So that's why we created this, to put everyone in one place. We'll have everyone's contact information on the back end. Their stories will be on the front end, and you can sort. So this is how we're going to use the stories, obviously, to get our point across to legislators and other electeds when we meet with them. It's going to raise our visibility. We can share these stories on social media, including the weird ones that are being tanked by Elon Musk. And also, as we identify folks with stories, some people with stories are already involved with our movement, but most of them are not actually. Most people kind of find us because they've been impacted by the healthcare system, and they're just for the first time realizing there is a movement to make healthcare right. And so when they share our stories, we want to connect them with their local organizations, which I know a bunch of you work with those local organizations or are leaders in those local orgs. So we want to create a leadership pipeline where folks who've been directly impacted are sharing their stories, but then moving on, and if they're willing to, taking on additional roles as activists and leaders in their local movements. And just like Donna said, letting folks know that they're not alone, that they're not isolated, this is not their fault, and that this is part of a systemic issue. And there's something liberating, I think, about it's very easy when something terrible happens to you in the healthcare system to blame yourself. I know I did. To think, oh my God, what if I had just done something slightly differently? Or, should I not have been admitted to that hospital, even though I was just following my doctor's orders? Maybe I should have stopped myself or thought twice about it. And it's really none of our faults, just as patients. This system is really rigged against us. And once you learn that, it's very, I think, empowering and liberating just on its own. So. All right, so this is what the website looks like, and I'm also going to drop a link in the chat if you want to go and visit on your own. So we have about, oops, no, that's not where it's going. Here we go. So this is what the front page of the website looks like, Voices of U.S. Healthcare. So far, we've got about 100 stories up there. We've populated it initially with folks who have already shared their stories with us in the past. So folks who gave us permission to share their stories publicly. And you're going to see that there's a bunch of tabs there on the bottom. So there's there's the logo, which Jillian designed. I think it looks beautiful. There's a quick description of the project. There's a link to if you want to submit your own story. And then there's these 5 kind of menu items where you can sort the story according to different criteria. You can sort by availability, and that is that's going to let you sort by whether people are willing to tell to speak to a reporter, to speak to the press, or if they're willing to speak at public events. So you can look to a journalist might use this database to identify folks if they're writing a story about cancer care, for example, and access to care. They could sort for folks who are dealing with cancer and who are willing to speak to the press. We have a menu item about the challenges that folks face. So that's going to be things like medical debt, like cost barriers to care, like upcoding, which we get from a lot of Medicare Advantage plans, for example. And then you can sort by condition. That's the actual medical condition that folks are dealing with. So you can sort by, diabetes. You can sort by cancer care. You can sort by heart conditions. Then we let you search for insurers. Minimally, you can search for, public insurers versus private insurers. You can look at Medicaid stories, Medicare stories, Medicare Advantage stories. And we're for folks who enjoy calling out their private insurer by name, we're going to list the actual private insurer who did the wrong thing. So you'll be able to search for everyone who's been negatively impacted by Blue Cross Blue Shield across the country, for example. And then lastly, you can sort by state. And when we have enough stories, I think we'll also let folks sort by congressional district to narrow that down even further. And this next slide is just this. I'm sharing my own story page so I don't embarrass anyone else. This is just what it looks like when you click through to one person's story page. If they've uploaded a video of themselves telling the story like I did, then you can just hit play and watch the whole video of the story. If they've submitted a profile picture, you'll see their face. And if not, you'll just kind of see the logo for the Voices of U.S. Healthcare. And then below all that, there's the written version of the story. And then at the very bottom, it'll tell you a little bit about the availability of this particular speaker, whether they are willing to speak to the press at public events, and letting you know that you can quote the story as long as you attribute it to the site. All right, and I'm also going to drop this link in the chat so you can go on your own, since I'd encourage any of you who have a healthcare story and who have not yet shared it with us to go to this page. This is just the page where you go to share your own story with the Voices of U.S. Healthcare projects. So it'll ask you a few questions about, again, sort of the same stuff we went over, the state you're in. It'll ask you, you can either write your story or you can record a video on your phone and just pop a link into this thing. We'll ask you for a profile picture if you want to. And it also gives you a bunch of options to be as anonymous or out there as you want. So you can, for example, you could be listed according to your full name and your state, but if you want to be a little more anonymous, you can use just your first name and your state, or you can not use any name at all, and we'll just list the state that your story comes from. Right. And of course, going along with all the other things we talked about, we're going to need the help of you folks here, and also Medicare for All activists around the country to kind of build this project out. We don't want just 100 stories on the database. We want hundreds of stories in every single state, according to every single condition, every single sort of encounter with the healthcare system, so that in every situation, if Congress has a hearing about, inadequate health insurance coverage for folks with diabetes, we want to be able to quickly identify folks with powerful stories in that area and to try and intervene, and to make a call for Medicare for All at that hearing, and to submit our testimony. So you can help us by helping to identify other folks with stories, whether that's just folks in your own personal network, or if you belong to an organization, like I see, John, you're just near the top of my screen here, Healthcare for All Oregon. If Healthcare for All Oregon wanted to take responsibility, for example, for IDing a bunch of stories from folks in Oregon, and in fact, most local groups have done this already and have already done some story banking. So it would just be connecting those folks with the national database, the national project. Then that might be another way. You could connect us with an organization and we could set up a meeting to talk about how we could collect stories and share them together and use them effectively together. And then lastly, it actually takes a lot of time when someone submits their story to process that story, to write a thoughtful reply to the person who wrote it, sort of validating everything they went through and giving them supportive language, posting it up to our website with all the details involved. So far, we're estimating it takes about 20 minutes to process each story. So if we get 40 or 50 stories like we just did a couple of weeks ago when we asked for Medicaid stories, it's potentially 20 hours of work a week, which would be half of one of our full-time staff people. So we're trying to build a team of volunteer people who are also willing to help out behind the scenes, processing people's stories, replying to them in a thoughtful way, and then also posting their stories to our website.
So there's a last but not least here, a very, very important part of what it takes to get this work done, right? And that is resources. Donna, do you think you could just say a few words about what we do here at Healthcare Now and why it's important to donate to this project?
Sure, I'd be happy to. First of all, this project is just everything we need in this movement, not only to have people be able to share their story because it matters so much, to be heard. Dignity heals people, it really does. And the reality is that this work isn't free. And as frustrated as we all get with not being able to match the resources that insurance companies have and pharmaceutical companies have and provider corporations have, and those nonprofits like my own Kaiser Permanente, a nonprofit that makes $3 billion a year. We're up against some big forces, and nobody thinks that we're going to ever have the resources to completely match those forces with the economic influence they have, but the people influence we have matters too. The reality is we need both. We need funds in order to do the work that Ben and Jillian do, and their training of people who help them in the office, whether those be volunteers, whether they be students who are learning whatever that might be. I've been with healthcare now for 16 years now. It's a long time. But the reality is that healthcare now's work has been done for many years and has been powerful in terms of being the grassroots glue that holds this movement together, while the other organizations that also support Medicare for All as a part of their agenda are doing their other work, which may be more important at the moment for them, whatever the pressures they face. So we need money. Healthcare now does need money. One of the things you can do to kind of work together with these two projects, I think the project of telling our healthcare stories and the ongoing project always of raising money, is to tell your other organizations about what we're doing. Get people to put their messages in. There are people out there who do want to donate money. Maybe you're one, and that would be great. That's always wonderful. But there are other people out there who perhaps organizing isn't their thing, that they would rather give some money. That'd be great. Let's get them involved and get them giving so that we can put some more energy. I've heard lots of ideas from a lot of people over the years, and advertising is just one of them. But Ben is so right. It's so expensive. So we have to work with one another. And if each of us puts in a little bit of time and a little bit of money, the tipping point will be reached much more quickly with much less pain than we're feeling right now. So while you're putting this out, while you're sharing this link with everybody to get these healthcare stories in, please also share with them that Healthcare Now is an organization that was formed in 2004 when the first Medicare for All bill was introduced, HR 676 by John Conyers. And it has been one of the few that's been going strong for this long and has done such important work in this area. And on that, if anybody needs me to talk to somebody or do a pitch for a group or whatever, I'd be happy to donate that. And thank you all for being here tonight. So many of you I recognize from our travels around when Sicko first came out. Some of you are brand new to me, and that's awesome. And I'm so glad to see that. Jillian, you honor me by saying that you came to this movement through Sicko. That always makes me want to cry when I hear that. And Ben, you know, you and I have worked together for so many years, and you are family to me, and we've got to get this done together, not just for one another, but for the generations that come after us. Thank you.